Good afternoon, everybody, and welcome to the Colorado Fruit and Vegetable Growers Association Lunch and Learn webinar, What to Do if an agriculture employee tests positive for COVID-19. I'm Adrian Card with Colorado State University Extension and founding board member of the Colorado Fruit and Vegetable Growers Association. I'll be your host for today's webinar. Today's webinar is focused on helping you learn reporting and mitigation next steps in the event of an outbreak at your farm, ranch, dairy, etc. CFVGA is the go-to resource for Colorado's fresh fruit and vegetable farmers. We connect Colorado growers with industry, government, academia, and consumers to strengthen and expand Colorado fresh fruit and vegetable production. Learn more at coloradoproduce.org and follow CFVGA on Facebook and Instagram. CFVGA is excited to thank and acknowledge its sponsors during this presentation. On the platinum level are John Deere 4 Rivers, Western Growers. Gold sponsors include Agfinity, American Ag Credit, Food Maven, Sakata Farms. Silver sponsors include Aquatic Resources, Bijou Seeds, Certis USA, Colorado Potatoes, Decade Products, D-Line Box and Display, DeSanti Farms, Fagerberg Produce, Goen Seed, Holler Seed, King Supers, Landmark Packaging, Millburger Farms, Farm Credit of Southern Colorado, Hiracata Farms, Monte Vista Co-op, and NatureSafe, Netafim, J&J Supply, Organic Supply, PSL Law Group, Rocky Mountain Farmers Union, Seedway Vegetable, Strohauer Farms, Target, The Packer, TNT Packaging, Valley Irrigation of Greeley, Western Sayre, and Whole Foods. A little bit of housekeeping before we get started with our presenters. If this webinar is hacked, if you will, we've had disruptions in webinars, some Zoom history with this in webinars. I will attempt to remove the disruptive entity from the webinar. If I'm unable to do that, I'll close the webinar down immediately and we'll do our best to regroup and reconvene with you. Your primary method of interface today is going to be through the Q&A box. Go ahead and mouse over your Zoom screen. You'll see that Q&A icon at the bottom. Go ahead and click on that, see what that looks like. You can enter questions for our presenters there. We'll answer those either by text or by voice back to you. And you'll be able to see all the questions that everybody asks. So monitor that. You can kind of see where the conversation may be headed. You can resize your Zoom window as you need, move it around, make sure that that fits for your needs today. I'll conduct one poll with you at the very end of the webinar to determine educational outcomes and understand what you've learned. This recording is going to be posted to coloradoproduce.org/COVID-19. Very excited to have our two presenters with us today. Dr. Kristen Fedak and Jenna Beard are from Colorado Department of Public Health and the Environment. Kristen is an environmental epidemiologist and the occupational health coordinator. In the state's COVID-19 response, Kristen serves as the subject matter expert for the industry, workplace prevention, mitigation, and response. She was the lead author of the Colorado Public Health and the Environment COVID-19 Agriculture Industry Guidance and has supported outbreak response in several agricultural industry settings throughout the state. Gina is a stationary source air pollution inspector in the Air Pollution Control Division. Gina's expertise of inspections and compliance assistance, in addition to a passion for health equity and environmental justice, led her to work part-time with the state's COVID-19 response industry outbreak prevention, mitigation, and response team. With the industry outbreak team, Gina works with topics including migrant and seasonal farm worker advocacy, workplace guidance in various agricultural settings, youth and school athletics, and the sports industry. Additionally, you'll see two of our panelists are Brad Turpin and Chad DeVolen from CDPHE. They're here to help answer questions as those come up. So we've got a brain trust, if you will, from CDPHE. So bring questions. This is a great opportunity to get those answers related to reporting and mitigation. So with that, Kristen, let me pass over screen share to you. Looks great on my end.
Okay, and now you can hear me as well, hopefully.
Yes.
Great. Well, thank you for that introduction, and thank you for having us here. So today our goal is to sort of give a presentation about 20-30 minutes at most that hopefully will answer a lot of the questions that many of you submitted when you registered for the webinar. And then, as Adrian mentioned, please use the Q&A function to add additional questions that maybe you didn't get to ask when you registered or that come up based on what we talk about, and we will try to answer some as we go and some at the end. So our presentation will talk about essentially what should be done to prevent cases from occurring within your operations, then focus on what happens when someone is sick, both when someone is sick in general, and then move into if someone were to test positive for COVID, talk about when an employee can come back to work and what that looks like, and then what would be considered an outbreak as opposed to individual cases occurring. So real briefly on prevention and best practices. Hopefully by this point in the pandemic, you all have sort of been inundated in information about prevention and best practices. I think that's the goal of the CDC and the State Health Department at this point. But I wanted to draw your attention to two different places where you can find resources. So the first, and resources that are specific to your industry. The first is on the CDC webpage that about a month and a half ago now, there was a specific guidance released for agricultural workers and employers. And I have the short link to it here on the slides, and we can make sure those get out to everyone who registered as well if you don't capture it down now. But there's a relatively detailed document that talks about really applying some of these prevention and best practices specific to the agricultural industry. We also have on our state COVID website, under our guidance and resources page, a number of documents that could be useful to the agricultural industry. There's a general workplace outbreak guidance, which is really kind of condenses a lot of information that comes from a lot of really varied sources through the CDC and others into one sort of handy guide that you can use in thinking about how to operate a business or a workplace. There are also then some specific guidance for things like cleaning or thinking about masks and protective equipment. And then when you look in the section called sector-specific resources, there's two documents I want to draw your attention to. One is a short document that contains a lot of different sources of information related to migrant and seasonal farm workers. This is something that Gina really led the effort of putting together. And then it's the third one down on that list now, the guidance for the agricultural industry, which is a document that I was the primary author of with some support from individuals in the Department of Agriculture, the Colorado Migrant Services, Colorado Legal Services, Migrant Division, Jennifer Rodriguez there, who I think is on the call as well today, and others. So real quickly, the basics of prevention and best practices related to COVID-19 are about managing infection control and infection spread for that respiratory-based virus. So this involves wearing PPE, primarily masks, physical distancing, hand washing, and screening. And I hope that is words and terms that you all are very familiar with now. Thinking specifically about the agricultural industry, though, we have some interesting considerations. So when we think about wearing PPE, a question that often comes up is, well, is it required, and under what sort of working conditions? How do we balance this? So right now, the actual legal requirement through executive orders by our governor is that masks should be worn in indoor public places. So for workplaces that are indoors, masks should be worn at all times. It's encouraged to wear your mask outside as well, and generally really at any time when you're around other people. We have, through the course of this pandemic, focused on, between the mask wearing and physical distancing, an idea of 6 feet being kind of this magic number. And so as a little background on that, we know that if you are within 6 feet of another person, the risk of transmission, were that other person to be carrying COVID, is higher, because we're looking at that as a distance in which a larger droplet that would contain the virus, kind of a respiratory droplet, is able to kind of project and travel. So if you're within that 6 feet of another person, you're at high risk of having exposure to those respiratory droplets. Mask wearing at that point does a lot of good to help prevent those droplets from getting towards that other person within that 6 foot distance. Recently, you may have been following news and the media and noticed that there has been a push for mask wearing at times when people are further than 6 feet apart. This idea that really anytime you're around others, and that has to do with the idea that those respiratory droplets are not necessarily the only way that the SARS-CoV-2 virus spreads. We're seeing some scientific evidence suggesting that smaller aerosolized particles can also be viable for transmitting the virus. So this does not negate the fact that that 6 foot distance respiratory droplet is a major concern. It's just adding that on top of that, we think that there may be reason to have concern for that potential for smaller, more aerosol sorts of transmission. So these smaller aerosols, you essentially can think of them as acting more like a gas and less like that particle. So think about those larger particles as like a projectile that kind of comes out, that classic like throw a baseball, it kind of goes so far and falls to the ground. Those smaller, more aerosolized virus, think of it a bit more like when you're outside in the cold, in the middle of winter, and you can see your breath and it kind of just spreads. So that's the concern and the kind of rising concern in the literature that brings us to this idea of suggesting that physical distancing really as far as you can, and wearing masks really under any condition where you might be sharing airspace with another individual, is the best you can do. Now with the agricultural industry, physical distancing can be really difficult at times with the work that you're doing. So what we look for there is, essentially, have you made any sorts of modifications you can to how people are working, the processes that you do, to really try to encourage that distancing and spacing. Other options when distancing is not as possible as you would like are to think about cohorting your workers together, so that those who have to work close together or tasks that have to be performed in that close distance can be done by the same people together. So you have a group of 3 people who are always paired together with each other for that task and not paired with someone else. So that way, if one of those individuals does happen to get sick, they have limited the number of other workers that they could have spread it to, because the number of other workers that they are in that close contact with is limited. And I will let Gina talk about screening.
Thanks, Kristen. I'll remote into you. Hopefully. Okay, and so screening is another way to not really prevent you from contracting, you or your employees from contracting COVID, but it really helps reduce the spreading of it, if you will, much like cohorting, what Kristen was saying before. Let's see if this will go to the next slide. Oops, did I do that? Okay. And so you may ask yourself, well, how do I screen? There are some questions that may pop up. What media is being used? What do you ask during your screening session, if you will? who performs the screening, and then who's the responsible party for when somebody comes in and they do have symptoms or they are sick. In terms of the media, there's so many different ways to go about it. It really is a way that works best for you and your business and your facility. So either using an app for your phone or tablet, a paper sign-in sheet or a Google form, anything like that would be sufficient. Anything that works for you, essentially. And any type of recording is good, but it's not necessarily required. But it would be helpful if somebody did come in who was sick. So you could just toss out probably all the healthy screens after, after review. So also, what do you ask during your screening session? Obviously the temperature, that's a big one. Right now, I believe it's 100.3 degrees Fahrenheit, and above or below. So if they're above it, maybe you should have a little chat with your employee about how they're feeling as well, and a little bit more in depth. And also asking for various symptoms of COVID-19. So common ones being like coughing, shortness of breath, having difficulty breathing, having runny nose or congestion, headache, nausea, in addition to that temperature. And maybe a question of, are there any other symptoms that you're experiencing right now as well? So you don't have to have this huge exhaustive list of information that we have pulled throughout the last few months of how COVID affects people. And the next question of who performs the screening. There are also different options for whatever works for you and your business, considering self-reporting and self-checking via an app, having a manager who is responsible to either take a temporal temperature, so like the forehead temperature, or asking the questions, or something else that works for you. But those are the two main ones that we've been seeing. As for the responsible party, and I'm talking about the manager, is somebody who can either make sure and send somebody home, or put it on the employee. The employee is responsible, obviously, not to come to work while they're sick, so they can let you know ahead of time, and to accurately self-report what their symptoms are, how they're feeling, etc. With that, the employer themselves is responsible for ensuring that the policies that you have put in place kind of create a culture that encourage and educate the worker not to come to work if they're sick. So not putting the pressure on them if they do actually have symptoms to come in. And with that, so if somebody comes in with symptoms, Kristen will walk you through some steps.
Right. So when someone has symptoms, the first and most important thing to know is that they should be sent home. Individuals who are experiencing symptoms shouldn't be at work. What you should do if you identify someone who kind of comes into your workplace who has symptoms is encourage them to first return home, but to seek medical attention as appropriate. So this includes encouraging employees who are experiencing symptoms to see a doctor or go to a testing clinic if one is available within your area. And then an individual who has symptoms should not return to work until they are symptom-free. So one thing that has come up a lot is that we see many symptoms of COVID-19 that are non-distinct. They overlap with a lot of other things, particularly if you are screening based on symptoms to come in and you say, okay, so one of the symptoms of COVID-19 is congestion, runny nose. Well, that is also something that you may see commonly, particularly in the agricultural industry where workers are outside. People have seasonal allergies, for example. And so how do you know the difference between COVID-19 and seasonal allergies? So the answer of how you know the difference is with medical attention, a doctor being able to weigh in. Your responsibility is to ensure that an individual who is showing symptoms that overlap with COVID-19 is not in the workplace. That individual has the right to decide whether they think they should see a doctor or they think they shouldn't. So let's say it's someone who knows that they have, get these allergic reactions, seasonal allergies, and they say, I'm really feeling like it's just my allergies. They don't have to see a doctor if they don't want to, right? And so the precautionary approach to do is have your workplace policy be that if they are actively experiencing symptoms, they should not be there, but they can return to work when they are symptom-free. So from a precautionary standpoint, if you presume any symptom is COVID, a 10-day isolation period is what the reaction is to COVID, and I'll talk about this again in a minute. But so what you could do as an option is say that you want 10 days that the person is out of the workplace after symptoms started, and having seen the resolution of symptoms in that time. Now that's a really long time to have someone out of work. Let's say if their symptom was, a headache or some congestion, it's cleared the next day. And you're saying, do I really have to keep everyone out of work for 10 days when they are, an adult who had a headache or some allergy type reaction and it's cleared a day later? So a less precautionary approach, but that is a reasonable approach, is to understand that there are things beyond COVID right now that people are getting sick with, and how would we handle that in that kind of pre-COVID world? So choosing something like saying 24 hours symptom-free or 48 or 72 hours symptoms-free, depending on the symptoms, what they are reasonable approaches to take when a person is experiencing that mild symptoms. If somebody's symptoms include a fever, or they're experiencing multiple symptoms, my recommendation would to go that more precautionary approach. Presume that it was COVID, because it's really checking the box of a lot of different things here, and go for 10 days minimum that they're out of work. If you really suspect that someone has COVID based on that initial presentation of symptoms or exclusion from work, it's a good idea to start contact tracing immediately. So thinking about, while you wait for that individual to seek medical attention or get a test result back, to start thinking through who is in close contact with this individual in the workplace, and identifying those people. If an individual tests positive, public health will be notified and will come in and do that contact tracing. So it's your way of getting ahead of that, being able to assist public health when we ask for that information, really kind of having your ducks in a row about it. But certainly with some time delays that happen in maybe that individual, the time between when they first felt symptoms and when they find out they tested positive, anyone who may have been exposed to them or a close contact, that's a time period where they could be spreading it to others. So being proactive about that and being ready to identify and know who those individuals are is a good idea. So what happens when someone gets tested? There are two things. They can have a positive test result, possibly, and that's a more straightforward one to handle. So a positive test result essentially means that individual has COVID-19 and they need to be isolated. The requirements from public health at the state level, which align with the federal CDC recommendations and are being used by all the different local public health agencies in the state of Colorado, is that an individual who tests positive, if they are experiencing symptoms, and that is what triggered the testing, they need to isolate for a minimum of 10 days after that the symptoms started. and they need to be at least 24 hours without a fever and see some resolution in their other symptoms. There could be symptoms that linger. They don't need to be completely 100% feeling better, because we see with COVID-19 that there are things like feeling a shortness of breath that might linger for quite a while for someone who's recovered and no longer contagious. But that 10 days at a minimum and 24 hours without fever. The individual who gets a positive result will be instructed by public health authorities and their medical provider about what to do. So you as the employer should be aware of it, because it indicates, when they should or shouldn't be at work again. But they'll be instructed by the individuals who were part of them getting tested. Now with a negative result, things are a little more complicated. So again, public health should provide instructions to the individual who got tested. But with the PCR test that we run to check for COVID-19, we have what we call a false negative rate that's pretty high. So among people who truly do have COVID-19, about 20 or to 40% are coming back negative. So this means when the person is really positive for COVID-19, 20 to 40% of those will actually get a negative test result. When the test result comes back positive, we're very confident in it, but when it comes back negative, it's a little unsure. So what we do with a negative test result really depends on the situation of why the person was tested. If the person's symptomatic, but the test comes back negative, they should continue to work with their doctor or a medical clinic, and they shouldn't be at work while they're symptomatic, like we talked about before, even if you have a test result back that is negative. Now, if the person is not symptomatic, but they got tested because they were a close contact, had exposure to someone who they know is positive, they should continue their quarantine period that is required by public health. So that's a 14-day quarantine where they shouldn't be coming in contact with other people. We don't use a negative test result to allow someone to be released from that quarantine early because of that high possibility that that's an incorrect negative result. Now, if the individual is not symptomatic and they got tested for some other reason beyond that kind of I'm in quarantine because of a close contact exposure. So let's say it's, there just was a testing clinic that was available and they were interested and they wanted to go get tested and the availability was there, but they haven't had any known recent exposure and they're not symptomatic and that negative test result comes back negative, they're okay to be at work. Let's say that maybe it's like a second or third remove situation, right? So it's they don't have any symptoms, but their family member's friend had COVID and they've never interacted with that person who had COVID, but they've interacted with their family member who interacted with them. You've got that kind of like chain of being removed. So they were concerned themselves and decided to get tested, but it comes back negative. Well, they're not someone who should be quarantining officially. Therefore, it's okay to take that confirmation that the negative result means they can continue to work just like they were before. And so, with this information, that means, when can an employee return to work? The kind of summary there is that if an individual is symptomatic, but with working with their doctor or the kind of best medical advice that's available at the time, mildly symptomatic, and their symptoms resolve, thinking about something like a 24 to 72 hours after symptoms have resolved is a reasonable approach. If it's suspected that it could be COVID and they are symptomatic, you get a test. They hopefully get tested because of working with their doctor. And so someone who comes back positive needs to go at least 10 days out of the workplace. And someone who was a close contact exposure to that positive should be quarantining and therefore not at work for 14 days, regardless of whether they get a negative test result during that time. So the big question that this brings up is, essentially, but, agricultural is critical infrastructure, and you can't operate without employees, right? So I want to emphasize a few things. One is that being able to isolate individuals who are sick and quarantining people who are exposed to those who we know have COVID-19 is really the best thing we can do to stop it spreading to more of your workers. So if you have a single case of COVID-19 in your workplace, really thinking about how you can be creative to adjust your operations and allow your workers who need to be quarantined because they were that close contact exposure, allowing them to stay home, stay out of the workplace, is the best thing we can do to really proactively stop the spread of COVID among your other workers. However, if your operation really is not suited to continue without those workers there, your sick individuals, those who test positive for COVID-19, really should never be at work. There's not really any exceptions to that when they're in their isolation period. But those individuals who were exposed and who are close contacts, who should be quarantining, because of the nature of the work they're doing, some flexibility in thinking about whether some of those individuals could be at work. This is something that we want to work with public health about if that situation comes up for you, as opposed to a kind of blanket where critical infrastructure we don't have to quarantine. But public health authorities, whether they're the state or the local ones, would really help work with you to think about whether some of those close contacts fall into lower risk than others, so that we can think about, as opposed to, say all 10 of them, is there 5 of them that we think are the highest risk who really should quarantine, but 5 who we could allow to kind of come have some roles here at work to maintain operations with these additional precautions in place for them. And I'm sorry, Gina, I realized that we said you were going to do that one and I skipped over you there, so I'm going to keep talking. But so that's the kind of general approach with one case. So when do we consider something an outbreak is the next big question. So per the state guidelines, an outbreak is when we see 2 or more positive cases with onset within a 14-day period. And that's regardless of the size of your workplace or your operations. I think most of the people on this call are kind of representing or thinking about smaller types of workplaces and smaller operations. But this kind of tends to come up more so when you have a larger one. So yes, if it's 2 cases among 10 employees versus 2 cases among 1,000 employees, 2 cases within 14 days is a trigger to contact public health and to start that investigation. The public health authorities will work with the employer and with the cases to identify who should quarantine, like I just talked about, recommend what type of testing should be done of other employees in the workplace, or determine if there's a testing strategy that could be applied. I know there were some questions about testing, and each local county and area right now throughout the state has sort of different approaches to testing based on the availability and needs within their community. And then the other thing public health will do is sort of work with you to evaluate what the workplace practices are like, to try to identify areas for improvement and monitor that situation. So if you have 2 or more cases within your workplace, the way to go about, contacting public health, you can either go through your local public health agency, and I included a link here on the slide to how to find and contact your local agency based on the county that you're operating in. There is also the option to just directly contact CDPHE. There is a form which is available at the link I've provided here on this slide called an outbreak report form. And so filling that out and emailing it over is a way to also identify to our teams that you have 2 or more cases within that 14-day period and start the process. So some special cases to think about when you say, so 2 or more cases, what does that mean? If you have family members who, 2 family members who are sick, if one works on the farm or the operations and the other does not, the person who is that family member who doesn't work in your operations doesn't count as part of your outbreak. They could be a source of exposure for that worker, but if they don't work in the operations, they don't count as part of the outbreak. It's only thinking about people who directly work in those operations. So let's say you have 2 family members who work together in the operation. If there's only the 2 cases, they're people who family members who live together as family, and those are the only 2 cases you have, we wouldn't consider that an outbreak in the workplace because they have that family connection. If you, for example, have 3 cases among your workers, 2 of whom are family members who live together, but 1 is not, that then does count as an outbreak. And when thinking about the size of the outbreak and the number of people, we would count it as 3. So a little confusing there in that sense, but essentially a family member who doesn't work with your operation is kind of a tangential secondary case and not part of the outbreak. 2 family members and only those 2 who are sick, it doesn't yet trigger an outbreak, but 3 or more then with some family connections would be an outbreak. If you at all are looking at it and going, I have 2 or 3 cases and I'm not sure here, contact public health because we're essentially the ones who can make that distinction of do we call this an outbreak or not, and where do we go from here for you. So contacting public health to say I'm not sure if I have an outbreak is better than being unsure and not doing anything about it. Another sort of special case situation, thinking about people living together, is non-family individuals who live together because of the work that they're doing. So communal housing at a different sort of agricultural setting. So we think of this as the communal housing being an extension of the workplace, because the reason those individuals who are not related are living together and living in this communal housing is because of their job. And therefore that communal housing is an extension of the workplace. And so individuals who have that living together connection in that way would be considered that workplace exposure and workplace outbreak.
And I want to kind of take a second to answer a question about, are you allowed to ask/require testing if your organization pays for the testing? I would say, yes, you're allowed to offer testing, but you're not allowed to require testing. I think it's best to think about following your own policies to guide your decision in what you want to do with this individual, especially if they have symptoms. So we want to go on this looming question that's coming. Will the government shut us down if we have a positive case? No. We want to acknowledge that it's like agriculture is such an essential industry, and a lot of the industry is vital to Coloradans. We have to eat. You have to feed your cows. You have to plant. You have to harvest. You have to water your plants, etc. So it's not as easy to just shut down your farm and hit the pause button, if you will, or telecommute if you can't use an app to feed your cow or milk it. But anyway, agriculture is very important to our daily lives. However, as a very essential industry, it is not a get out of jail-free card just to allow rampant COVID outbreaks to occur. So instead of focusing on will the government shut us down, it's more so where do we concentrate our efforts? And for the agriculture industry, it really needs to be on the prevention of outbreaks. So for that, like I'm trying to give you a little bit of a quick mindset of how we want to run things as a mutual relationship as in our closing minutes. So it's really a thing of inspections versus COVID response. Oops. There we go, sorry. So inspections are based off of compliance with regulations. You must comply with X, Y, and Z regulations in order to avoid fines, avoid being shut down, et cetera, et cetera. For example, me as an air inspector, I inspect off of state and federal air regulations and determine if a facility or a source of pollution is able to demonstrate compliance with their applicable regulations. Very boring, pretty cut and dry, if you will. COVID response, however, is more of a team effort. So think of it as like a sports team. You are a part of this big conglomeration to manage the pandemic that affects everyone. Everybody in Colorado is experiencing the effects right now of COVID-19. And we are in this together. We are one big Colorado team. We have to work together, not only for the greater good of our communities, but also for your own businesses to be able to work with some aspect of normalcy. So say you would want to work to prevent as much as you can in order to prevent all of your workers from having COVID at the same time. So, and then you would essentially have to shut down or do something pretty extreme to change your normal way of daily work. And so that's what the focus is on mostly for the agriculture industry. Oh, and here you go. Teamwork makes the dream work, right? It protects your workers, it protects your community, and it protects everybody's food systems because you're the backbone of our state. You help us eat. I wrote down in a note, remember about the 3 musketeers, all for one and one for all. And with that, I'll go back to Kristen.
Yeah, and so our last sort of looming question that we wanted to address before we shut up and take some questions directly. Looming question number 2 is less of a question and more of a topic, liability and privacy. There are a lot of questions about this from everybody right now, and particularly employers. So I wanted to touch on just a few ideas. The first is, before I say any of this, I will say that I am not a lawyer. I am an epidemiologist. I have some background in law and some understanding of how law and workplaces interact when thinking about employee health. But I am not a lawyer. But the main points are, employers are liable for safe working conditions, which you likely know. So when we think about COVID, excluding workers who are sick with something that is communicable and can infect others in that workplace, excluding those sick workers keeps others safe. So you are allowed to do that. It is in fact your responsibility to do that, because allowing someone who is sick with an illness that is easily transmissible to others in that workplace is what you do to keep those other workers safe. Along those lines, inquiring about the health of your workers is necessary to keep others safe. So asking for our workers to affirm that they're not experiencing symptoms of COVID and taking a temperature, that is, you are allowed to do that as the employer. So as a comparison, so COVID-19, you are allowed to inquire about your employees' health, your workers' health with respect to COVID-19 because it impacts others in the workplace. I can't think of a situation related to agriculture where it would be okay for the employer to say, I require to know your HIV or hepatitis status. And you need to tell me whether you are HIV positive or not, because that has nothing to do with this type of job and the work that you do and the safety to others in that workplace. COVID-19 being a respiratory disease that can infect others is. So it is okay for you to ask about the health of your employees, about whether they have COVID or not, or suspect to have COVID under that regards. Questions come up regularly about, so if an employee is sick, do I have to pay for that? Do I have to pay them sick leave? I don't work for the Department of Labor and Employment where this falls under, but I've included a link here. So the big thing is we have the Family First Coronavirus Act that offers employee paid leave. The main points here are, do you have to pay for workers who are sick? It depends. If your worker is an employee who has COVID, under the Family First Coronavirus Act, they are entitled to additional paid leave up to 2 weeks if they are diagnosed with COVID, if they are instructed by public health to quarantine because of COVID, and under some situations, if they are the caregiver for someone who is supposed to be isolating quarantine or is a child and is unable to find other care due to COVID. If you have an individual who is experiencing symptoms and has to be out of the workplace, therefore, but isn't tested for COVID or chooses not to seek care in that sense, they are just sick. That falls under whatever your normal policies and practices are for workers who are sick and therefore can't come to work. Other liability questions. So employers are mandated to notify public health of outbreaks. So, and I mentioned that 2 or more cases. It may not be something you are used to doing very often, but COVID-19 is a reportable illness, meaning that public health authorities are to be notified by anyone who has knowledge of a person having COVID-19. So for you as the employer, when it comes to knowledge of multiple cases within your workplace, you are mandated to notify public health about that. If this has happened to you before, you've had a case or 2 already, and you look back and you say, wow, that was an outbreak and I just didn't know, you're not in trouble for not reporting it to us. Please let us know now. We like to retroactively know about anything we may have missed. But the idea here is if you, in the future, now that you've heard me say this, if you become aware of 2 or more cases within 14 days, you are obligated to notify public health authorities. And then what can you communicate about your employees to who? So the employer is expected to and allowed to, under privacy laws, communicate to public health authorities about your employees. You can tell us their name, you can tell us information about them, anything you know, you are allowed to tell us. We, as public health authorities, are protected under the HIPAA and privacy laws. So if you know the information, you can tell it to us. You can notify other workers about cases or illness that has happened in the workplace and has happened around them. Where we run into some kind of gray area is that you should be as discreet as possible. So let's say you have, I get sick, I have COVID. My employer is allowed to say to my coworkers that someone who works here has tested positive with COVID. You should know, we think, you are identified as a close contact of that worker, or you were not identified as a close contact of that worker. but you shouldn't, send a mass email out to everybody or a text message, hey, Kristen has COVID, just FYI, right? So it's use some discretion about that private details. Understandably, for a lot of workplaces, when you do that, everybody knows. So as the employer, as the manager, you should be discreet about talking about the specific individual and their private details, but it is understood and it is acceptable under privacy laws that when you say to coworkers, someone within your group tested positive for COVID and you deserve to know that and we need to let you know that. And look, they're a group of 5 workers and one is obviously out sick, that's okay. And then finally, I just want to add a note that public health, when investigating COVID cases, when working with you or the cases themselves, we don't inquire into what the legal status of that individual is. We want to know, the person's name, we ask about date of birth and some demographic information, because we want to assure that within all the different records we have or ways that the reports might come to us, we're matching the person with the right person, right? But we're not, we don't ask for social security numbers. We don't care, and we don't inquire into whether someone is here on a visa, what their immigration status is, etc. And so that is often a concern for cases. It may be a concern for the employer themselves. And I just want to provide that assurance to the best that I can, that the reason we ask about individuals' private details, their names, their date of birth, etc., is simply to make sure that we are not double counting people who have records under different names, that we know we're talking about the same people, etc. And so who do you have to notify when someone is sick, when someone has COVID-19? Do you notify the customers who have came to your farm stand or your workplace? Do you have to notify the farmers market managers or other workers, volunteers? Essentially, you should notify anybody who you think may have had contact with that sick individual. So, you go to a farmer's market and the person who is doing the direct, purchasing transactions with customers at the farmer's market, it probably is a good idea then to notify the manager of the farmer's market that we found out, that they were here and they now have COVID. And they were here 2 days before they were diagnosed with COVID. And let the farmer's market manager then decide there on whether there needs to be, notification out. If you have someone who works in your fields who is picking crop, and then someone else was, and they have COVID, you find out, but then it was someone else who was the one managing the sales at that farmer's market, you don't need to notify them. It's enough down the chain of transmission there. So the idea is, customers, other, neighborhood farms or vendors or whatever, think about essentially, if you think that the individual who is sick could have come in relatively close contact with that person, then you should notify them. If it hasn't, if they're, removed down the line a little bit, you don't need to notify other people. And then as far as the state or local health departments, when you have one case of COVID, the doctor or the lab that ran those tests will be notifying the state through the systems there, and you do not need to notify us for a single case. But if you have multiple cases, 2 or more within a 2-week period, you do need to reach out and notify local or state public health. All right, and I know it's 1 o'clock, so I'm going to stop sharing my screen, hand that over to Adrian, and hopefully we can take some questions.
Great, everybody. Thanks so much for hanging in with us. I'm going to do 2 things with us right now. I'm going to launch an educational outcomes poll, and we're going to multitask a bit. Check out that poll. Tell us what you learned, if you have lingering questions, if you learned something new today, if you'll use it. And let's roll through some of the ones that are spooled into Q&A. So Elise asked, if someone has a non-COVID symptom with no temperature, is it recommended to send them home?
That's a tough one. If it's a non-COVID symptom and no temperature, so overall, if someone's experiencing some sort of symptom, they're likely sick with something, right? And so if you don't have that concern that it's a COVID symptom, but they're generally sick, it's the best precautionary thing you can do for any sort of illness, right? Is not have someone who is sick there working. But no, if it doesn't fall into a COVID symptom that they're experiencing and their temperature is normal, they do not need to be sent home.
Great. Amy asked, an employee who is at home awaiting test results, she has an employee at home awaiting test results. She's identified the people who worked with her in the past week. Should those people be tested proactively?
Yeah, so that is a good question. It depends on what the testing resources are in your area. So in some areas of the state, there is enough testing available where anyone who really wants to is able to access testing. In those sorts of situations, it probably is a good idea to say, okay, we have someone who was sick enough that they got tested and we're waiting for the results. Yes, let's take those people who maybe were close contacts and let's recommend that they get tested because the availability is there. If tests come back negative and that first person's test comes back positive, those people still need to quarantine. So that negative test doesn't tell us anything helpful there. But if one of those individuals tested positive, finding that out earlier is better. So it's a good approach and a recommended approach.
Great.
If testing is more limited in your area, certainly if any of those close contacts state that they have a symptom of any type, they would be a priority to get tested because you know they were near someone who is sick and now they're experiencing some symptoms, even if you're waiting for that test result still. And then if anyone, so if that test result comes back positive for the first individual and testing is more restricted, that local public health agency should be able to help advise on those close contacts. Are they now able to be tested? Is it only ones who are symptomatic there, et cetera?
Kristen, one of the questions that when you and I first spoke about this webinar that seemed to land with me, and I wanted to have you speak to it during this Q&A, to the extent a farm, ranch, dairy has implemented the best that they can in preventative measures, if they get an outbreak, does that influence the recommended action that the state or local public health agency will require of that ag business?
Yeah, it does. So essentially you can think about it as, let's say an outbreak happens. And so public health becomes aware and they start talking to you and essentially say, okay, so what are we doing on, what does mask wearing look like amongst your workers here? When are they wearing them? When aren't they? How are we, enforcing it? What types of tasks are being done and how are people, how are people physically distanced to the best possible? Did you make these changes? And so essentially, if you have an outbreak and public health comes in and we start asking these questions and it's sort of like, well, gosh, you really aren't doing the best you can here, and that's obvious, blatantly obvious. You say, oh, well, yeah, we don't really enforce mask wearing because we just don't pay attention to it, or we don't think we should. Or you say, well, we do things exactly the same as we've always been doing them. The public health authorities are going to kind of crack down a little harder on saying, you need to do this, you need to do that. We're going to be giving you all the recommendations. And there's going to be a little bit of a level of this is spreading because we haven't done the best we can prior to us coming in. If you have already taken a lot of those actions, what happens when public health comes in is we talk to you about what you're doing, we hear what you're doing, and then we essentially say, okay, well, let's keep monitoring. Let's think of maybe if we get more head spinning about this, we can come up with an additional creative way that you didn't think of before, but it seems like you've got everything covered. And it's just the unfortunate nature of the fact that while you did everything you could here to try to reduce the risk, it doesn't eliminate it. So yeah, I really encourage everyone on this call to be thinking about, if I were to have an outbreak, would I be able to confidently say to the public health authorities or to the media when they ask about it, depending on who you are, that we did everything we could to protect our workers and to keep our operations running, and the fact that there is a COVID outbreak here is not because I was negligent as an employer.
That's great. And the authority is equal between local public health and state,
Yes.
right? Okay.
Yes, so the authority in Colorado, the local public health agencies have jurisdiction over their own counties. And so it is not a hierarchy where the local public health agencies report to the state. It is a partnership between the state and the local agency. So you would most likely be thinking about what the authority of that public health agency in your area is. Particularly on COVID, they are working very closely with the state. So we do see some differences in how things are approached from one county to another. They are usually minor differences. So it may be things like, as I discussed, that idea that, close contacts who need to quarantine. There may be some, cooperation about thinking about exceptions to that due to the nature of your operations. And the different local counties might have sort of different places they fall on the spectrum of that, for example.
Great. Beth Lachelle asks, you've mentioned to us about false negatives. Are there concerns about false positives?
Yeah, so with the PCR test, false positives are essentially zero. The only way you would get a false positive on a PCR test is if the test was contaminated by, the person who was running the test, the lab technician, and they have COVID themselves and they contaminated the sample. So false positives don't happen. That's one of the really nice things about the PCR test. Now, someone who had COVID can continue, if they were to do repeated testing, may continue to get a positive result from that PCR test long after they are no longer contagious to others, because that viral DNA, which is non-active, is, as far as contaminating another person, may still be present in their respiratory tract. But for someone who is, experiencing symptoms or that close contact, and they get tested with a PCR test, if it comes back positive, it's positive. Okay. There's a lot of discussion, and has been since the beginning of this, about antibody tests, antigen tests. And one of the problems with those types of tests is that you have both false positives and false negatives that can happen. So we consider that PCR test, which is what someone will get if they go to their doctor or a testing site, that one, false positives, really unlikely.
Okay. And it's not the feds nor your department, neither have the authority to require testing in Colorado.
Correct. Okay. Correct. So if a person declines wanting, it's a medical test, right? It's a medical procedure with all medical exams, procedures, etc. We can't require someone, we can't force someone to undergo it if they don't want to. So what we can do is say you're declining the test, which would give us some information. Therefore, it is best for the protection of others around you to presume that the test result is positive, act as if it were positive. And that's what we have an authority to do.
Okay, great. Veronica, you had typed in a question that's partial, and I think was related to a segment of the presentation. I can't remember the full extent of the question. If you want to type that back in, you're welcome to. Another anonymous person asks, our local health department did shut down a produce farm when they had an employee test positive. They were told they had to recall the food that had been sold and couldn't go to the farm to water, to weed, or to harvest. Can you help us so that this doesn't happen again?
Yes, that is an interesting comment, and I do see it came anonymously. I would love to know more information about that situation so that we can help think about, why the local health department did that and what the situation was there, and if some kind of communication there needs to happen to help with that. Yeah.
Great. And your on screen now, this COVID industry team email address, people can reach
Yes.
you there?
Yes, that is one that goes to, it'll send a message that myself and Gina get, as well as a few other people kind of within the health department who have been working on these issues.
Great. Amy asked, do we still need to wear disposable gloves when we're packing vegetables to give to customers, or is frequent hand washing adequate?
That's a really good one. You know, that's the glove wearing and that touch contact surface thing has also been an evolving area of science since the pandemic started. And, you know, my personal opinion of it is if you wash your hands before you do what you're going to do, touching that produce and interacting with customers, and then you're not touching your face, etc. You know, you've washed your hands, so if there's any virus on your hands, you're not transmitting it to the produce and you're not handing it over towards that other person. If you're thinking about, like, you know, working with customers or at a farmer's market where you might be doing a lot of back and forth between, you know, handing it over to another person and maybe you're kind of touching hands with that other person as you do it, and etc. Wearing those gloves could be a helpful way to keep yourself from, you know, whatever, if virus gets on those gloves from those kind of contact movements. Wearing gloves really helps a person think about not touching their own face. So it helps protect you, I think, more so than it might, you know, that customer in that situation. Yeah, so hand washing really is sufficient. The idea is that that glove is helping, helping keep any virus that you might pick up in that process from kind of going to you as a person.
Great. And that's assuming they're doing very good hand washing practices,
Yes.
right? Okay.
Yes.
And Jennifer Rodriguez, thank you, reminds us that there's now a Colorado law that requires employers to pay their workers sick leave when they're unable to work due to COVID-19 related symptoms. And I think, Jennifer, if you can remind us in this Q&A, it's employer is 16 or more, and it's up to, is it 6 days of leave? If you have a link, if you can drop that in the Q&A, that would be helpful to round out the conversation. And Veronica, circling back to her questions, thank you. She's wondering if a farm is smaller than 5 acres, is it possible that the government could still shut down in the event of an outbreak?
Yeah,
I think a small nonprofit grower. Yeah.
Right. I mean, essentially, if you have an outbreak that's hitting a point where it seems the only thing that's going to stop the spread and transmission from occurring, because it's out of control and it's spreading, you know, shutting down is our last resort option that we want. So I won't say that it will never happen to anyone. However, particularly with those smaller, you know, situations, and the fact that, yeah, your operations are critical, right? You can shut down an office place and tell people work from home, or it shuts down your business, or I'm sorry, but, you know, that fast food restaurant has to be closed for the next 2 weeks. The community will survive, and it might create an economic hit to that business, but the business will have to deal with it. They have an outbreak going on, right? But if you think about your situations, you know, yeah, if you've got cows that have to be milked, we can't tell you to stop taking care of your animals for 2 weeks, right? You need workers who can do that. Now, are you, you know, a produce grower that's at an area, you know, a time in your season when you're seeing the outbreak happen, and it's at a time in the season where you say, you know, if we keep all the workers get sent home and it's just, you know, the one farmer who owns this, who can maintain watering plants for the next 2 weeks without, you know, without any harvest happening, and it'll be okay roughly, you know, and then the workers are all come back and we'll be able to make up for it to some extent. You know, that's the idea. We would do that if we hit a point where we felt like other measures to help control and monitor the spread are failing.
So this is scale agnostic. If it's causing an outbreak, it has to be addressed.
Yeah.
Elise asks, what about the case of farmers markets where vendors are coming and potentially were exposed to market staff, customer, and other vendor? I think you answered this in part, but should the market communicate to staff, customers, vendors about the outbreak?
Yeah, I think that these become situations where it's really up to those, the farmers market or the person in charge to think where they want that information to go. If a farmer's market becomes aware that there was a customer who attended that market who has COVID and they attended the market during a time where they could have been contagious to others, if you choose to, notifying the different vendors that we were aware is good, right? Because then each vendor can take that information and do as they think sufficient. Certainly if a vendor is experiencing symptoms, but thinking to themselves, I haven't been around anyone with COVID, I don't know. Maybe it could provide some useful information to help monitor and catch that quickly. I would also say most likely, at least when I've been to farmers markets, my interaction as a customer with the vendors is relatively quick and at a distance, right? So you're 6 feet apart, you're not standing face to face up close, particularly nowadays, with that vendor. You're not having an extended conversation with them that's 10, 15 minutes long. You're kind of, the vendors are spending a minute or two, maybe 3 to 4 minutes extended with a person at a time, and they're kind of standing apart, and they're hopefully now also wearing masks when they do that. So the risk that a customer who was visiting a farmer's market has a close enough contact with a vendor to be a concern is relatively low. But sending that notification out that says we became aware that someone was here as a customer, it's a balance of, do you feel like your vendors would appreciate that information and it's helpful, the more you know the better, or is it that type of notification is going to scare people to an excessive amount. We do at the State Health Department have some example language for mass notifications of exposure events. And if you are interested in something like that, I would suggest talking to your local public health agency. They can help. They can also access at the state sort of those exposure notification templates that we have and provide that to you.
Great. Amy asks, where can I ask specific questions regarding COVID-related sick pay for employees at my farm?
Yeah, I have 2 thoughts. The first is that the Colorado Department of Labor and Environment, CDL,
Labor and Employment.
Yeah, Labor and Employment, there you go. They would be the people who know the best. In the recent past, there's been a bit of like, they know the Colorado one, but some of these kind of federal acts and policies they're less clear on. But I would recommend reaching out to them, and their general website has it. I would also throw out there, and hopefully she doesn't dislike me for saying this if she hears me on the line, Jennifer Rodriguez with Colorado Legal Services is a great person to contact for questions about this.
And she is already thinking along those lines. She's in the Q&A saying there's a FAQ from CDLE in addition to her as a resource that can help with this. She did put the, I just moved it in somewhere else, but the link to the Healthy Families and Workplaces Act in Colorado, that PDF, I've grabbed that and we'll put that in my resources as well and get that on the CFEGA website. But it feels like maybe the next stepping off point with this is a webinar more specifically around sick pay and legal aspects of this and worker rights, places where we can add value in this conversation. So with that, let me grab one more thing here. Really appreciate you guys making time, Gina and Kristen, to give us a taste of the knowledge that you have and help us understand how we can proceed more intelligently through this unprecedented time. So thank you both. This recording, thanks Elise for flagging for that, is going to be posted to, hopefully today, to coloradoproduce.org /COVID-19. And we'll be in touch on additional questions. If there's anything that comes up, guys, that you think would be helpful in terms of additional educational outreach, let me know. And really appreciate all of you, and have a great day.
Thank you.